Hello, we're joined today by Dr. Jim Hotz with Albany Area Primary Health Care. Dr. Hotz is a NACC 2025 Lifetime Awardee here at the CHI, and thank you so much for joining us today, because I've always heard your story, how you were the inspiration behind Doc Hollywood, but maybe you can tell our audience how you first got involved with community health centers.
Well, I was in medical school. Grew up in a family where we didn't have health insurance. There were 5 of us, but we always had Dr. Swint, no matter what, no matter when. That's what I wanted to be. But I couldn't see in the system that I was familiar with when I was at Ohio State where this was going to happen unless there was some special ways to expand the outreach of primary care. I was talked to my advisor there, and he suggested I take an elective in DC working with Dr. William Roy, who was working on legislation to make health care more accessible, especially primary care. He was working on the reauthorization of community health centers, the National Health Service Corp, HMO Act, and also Health Planning Act with Paul Rogers out of Florida. They call it the Happy Trails legislation, Roy and Rogers together, if you're old enough to remember that. So I worked there for 3 months and worked on legislation, especially the National Health Service Corp. And he'd made me promise that I would do that for a couple years and feedback to him about how difficult it is to take a good idea and to put it out, with the bureaucracy. So after I was finishing my residency at Emory University, I convinced my brother-in-law, who was my roommate in medical school, to go someplace with us. My wife is a master's trained PA and nurse. My sister had a master's in social work. We said we'd go anywhere. They couldn't find a spot for us. I was doing hypertension research with Dr. Neil Schulman at Emory at that time. He said, well, let's meet with the Commissioner of Health. He's a Jimmy Carter appointee. Jimmy Carter was president. And we said, we're willing to go, spend a couple years. And they showed us a place in Athens, Georgia. I get in a car and meet the mayor, all these communities, and say, here's your new doctor. I said, just what he's looking. This county had not had a doctor in 40 years.
In 40 years?
In 40 years. So at the end of it, we had a whole table. There was a chicken dinner and everything. If you've seen Doc Hollywood, it was just like that. And then I asked the mayor, I said, how far is the stadium from here? And he goes, what stadium? I said, we're the Bulldogs, Georgia Bulldogs. He says, you mean we're not near Athens? He says, no, you're near Albany. Also happened to be about 10 miles away from Plains, Georgia, where they had a community health center. And I went back and I told him that, and I said it was like being kidnapped. And he said, well, that community was clever enough to take charge of their health system. We knew you wanted to go a place needed. We knew you had a lot of talent, and we will assign you to the Improved Pregnancy Outlook program for the state of Georgia. So we met with the Commissioner for Health and then actually started writing the grant to get the health center going, worked with a wonderful community board where people came together, blacks and whites. 1978, that was not common. 15 years earlier, we would have violated the Jim Crow laws to do what we were doing. And we worked with a historically black college with public health, and were able to put together an organization. My career goals was to do primary care, but also research it. I'd read about Dr. Cindy Kark and the community-oriented primary care model, and I thought that's really what I was interested in, developing a research agenda around primary care, around the needs of specific communities. And when you get into South Georgia, where there's a lot of poverty, there's a lot of very unique needs and things arise. So it turned out to me, instead of 2 years, I've now in my 47th year there.
It's amazing, 47 years. And I know when you began at Albany, what you noticed when you went there with really high colorectal cancer rates, and that became a focus of your work. Can you tell us a little bit more about that?
Well, it wasn't just the high rates we saw. My dad died of colon cancer 1 year into that. So at 59, he didn't see any of his 18 grandkids. And as the research came out, we could see how effective screening rates were. So got involved in doing some special programs, working with local GI guys who gave us free colonoscopies. We developed a navigation system, and really successful in increasing the rate. There was a common myth that poor rural black people were afraid to know if they had cancer. Well, what I found out, they have no greater desire to die of colon cancer than rich white people. When you really sat down and talked to them and said, we can reduce your death rates by 80% by getting this test, we got people willing to do it. We also had to have a local hospital and our hospital has a big cancer center, Phoebe Putney Hospital, so we're allowed to be able to do that whole continuum of care necessary to actually manage something like colorectal cancer. We've subsequently added breast and cervical program through the CDC. We have a research project on prostate cancer and on lung cancer too. My mother died of lung cancer, so we have a lot of smokers and we have effective technology, but health disparities exist when highly effective technology is not evenly distributed. And our goal is to make certain that everybody gets the same shot.
That's right. And you're the focus of a new documentary, Doc Albany.
Yes.
And I've seen a clip of it. It's a fantastic documentary. Tell us a little bit about the focus of that documentary, which is about workforce shortages in that area.
Yeah, and we know that primary care, people live longer if there's more primary care there. And the documentary's purpose was to really show people what does that look like. And one of the Doc Albany is actually Dr. Favors, who works for us, who's an obstetrician. If you look at Doc Hollywood, he was a bit of a young, arrogant jerk, which at least my wife says pretty well, described who I was. But Dr. Favors chose to come there because she wanted to make a difference. The bureaucracy that was so challenging when I tried to join the Public Health Service, and I was a commission officer for 6 years, has been really streamlined. Bureaucracy now is highly efficient, highly effective at placing people. We have 20,000 people out there. So we were doing this documentary, and while talking to Dr. Favors, he gets a call to the delivery area, and they had a child who was going bad and had to do an emergency C-section. We happened to have the crew there, so we actually see a life saved because of a highly effective program. Started, Eric Redmond started that, and Richard Nixon signed it in 1974. So, a good idea crosses over both parties, Republican, Democrat, and putting primary care people and highly talented people like Dr. Favors. Now, the one thing we wanted people to know in this documentary is that I'm one case. There are 20,000 documentaries you could do about the people out in the field and all the good work we do at health centers. And what we wanted to do with this documentary is to really show the folks that people's lives are saved. There is a difference when you take a highly skilled person and put them, a clinician, out to an area that is underserved. So it's been an interesting career doing that. But through the years, we've looked at problems. We had a flood that was a 1,000-year flood. We threw 550 missions with the National Guard to go to isolated communities and deliver care. We started the first rural HIV program in the country, now manage 1,500 HIV patients in an area the size of New Jersey. We've got involved in colon cancer research, pneumococcal vaccination research, and what I found is this patient-oriented, problem-oriented, this system where we look at community-oriented primary care. It's a great research thing because what does the community need to be healthy? When COVID hit, we did 25,000 vaccinations. So we never know what's going to come. And then we try to work with local EMS. My wife came down, had a master's in nursing and was master's trained PA, but had worked in critical care and surgery units, so she started the paramedic movement in South Georgia. So you have to be integrated with EMS, which can make a difference, highly trained people in the field, integrated with your hospital system and specialists. And so it's a real team sport to be able to provide that. But having a primary care infrastructure makes such a difference.
Yeah, I want to go back to something you said earlier about saving lives, because I know the Morehouse School of Medicine came up with a study that showed that during COVID, communities with a health center suffered lower rates of infection and death. And certainly what you just said bears that out. And we also know that there are higher mortality rates linked with CHC closures. But I want to go back to your work during COVID, because I was telling you before we started, I remember talking to you because Albany area became a real hot zone during during the summer, I believe, in 2021. And you had just been on the phone with like 200 patients trying to fill their prescriptions. Can you tell us about that? Because I vividly remember that story.
The health system dramatically changed. People weren't coming in to see us, so I just started going. I have a special population management 200 EHR, so I started calling my patients. And I managed a lot of these folks for 40 plus years. So we called them up, make certain they had their medicines, took care of their problems, and realized what we could do. But the most important thing is my board of directors, my people living in that community said, you know, nobody's setting up an immunization thing. Let's do it. We set up an immunization thing. And, you know, it's a risk to do that. There's a financial risk. We had providers who were there who died from COVID they got. So it was not a low-risk proposition, but I was really proud of the team. And, you know, it's not one person who does these things. I mean, you've got to have a whole team around us. And we have a Marine base in town, and during that time I had several Marines come out to me, retired Marines, and said, Doc, he said, I'm just amazed and proud to be a patient here. And I go, why? He says, you're one of us. What do you mean we're a Marine? He says, Marines pride themselves as marching to the sound of gunfire. You know, when COVID hit, you didn't run the other way. You ran to that for your community. When HIV hit, rather than saying, we don't want to see these folks, we developed the largest rural HIV program in the country. When we could see the impact of cancer, we developed special programs around that. And, you know, that's why I say, and I encourage people to join health centers, if you want to make a difference. If you want to make money, you may go someplace else. If you really want to make a difference. I've got 4 kids, they're all doctors, they're all in primary care, and my daughter works at the Curtis Cooper Center in Savannah and loves the work she does. So, you know, I think what we can learn from COVID is what we learned from Hurricane Michael when it came through, Tropical Storm Alberto when we got a 1,000-year flood, when HIV hit, when we were trying to figure out how do you get our kids vaccinated. You know, we actually did research to help start the first vaccination registry in Georgia. Came out of our community health center, who works in collaboration with public health, local docs, and hospitals. So it's really a team sport. What the hardest part of the system of care, though, which is what I first saw when I talked to my advisor at Ohio State, is getting the primary care. There's got to be an access point. And as he told me, listen, son, you can either be part of the solution or part of the problem. If you want to be part of the solution, get up to Washington and make certain they know what they should be doing. At least you help them do that. And I'll tell you, Dr. Roy and Paul Rogers knew what they were doing, did some wonderful legislation that we're all, you know, on. And then the first time I came to one of the community health institutes, and then P&I was in '81 when, you know, we had zero funding when the Stockman hit. But NAC was able to coordinate us, get us together, and actually overcome that by one vote. At that point in time, I said, you know what, I'm going to be the first physician to get on NAC's board, because this is important stuff, and we want to make certain that we do our share too. You want to be part of the solution rather than part of that problem.
And since you lived through that experience in 1981, when it was very rough and health centers, you know, were nearly erased, what pearls of wisdom can you give us for today, for the challenges we're facing today?
Well, you know, you can whine and complain about it if you want to, okay? But as my old football coach told me, when the going gets tough, the tough get going. And I've told several folks, you know, our job is to find the solution, okay? Politics change, votes change, but the reality is the country votes. What do we do about it to make certain that the programs we think are important? So what you do is you get involved. I mean, that's why I go to Washington all the time. I talk to legislators to do it, because they want to get the view from the field. You know, what is it like? What was so great about this film we did is there's a baby, and you can hear that baby's first cry. People who watch it start crying themselves, because they realize if Dr. Favors hadn't been there, you know, I couldn't have helped them. That's not what I do. But we had a specialist, you know, who could take care of them and also make certain that we don't have a maternal mortality case, which is a big issue. So getting people in the areas where there's great need is one of the great things that the National Health Service Corp has done, community health centers have done, and of course NAC, which I'm a strong believer in, because it really allows us to put our voices up there in a very organized and coherent manner.
That's absolutely inspiring to hear. I just want to close with one question. Like you said, how long ago was it? 46 years when you first started and came down to Albany area and got hoodwinked into
Yes.
becoming the doctor there? What would you tell that young man who you described as kind of a jerk? What would the you now tell him back then?
If your goal in life is to make a difference, this is a great field. I wanted to do that, didn't exactly know how it's shaped. And then the other thing I tell folks, money will follow making a difference, value-based care and all that. But if your goal in your profession, if your calling is to make a difference, there's very few places where you can make more difference than what we do in health centers. So to that young guy that didn't realize that this was the solution, I was glad that Dr. Manny Zagunis, my advisor, told me that, get your butt up to DC and, be part of the solution. Dr. Roy encouraged me to join this thing because he said it's important that people get involved, and putting part of your career into going to an underserved area is a very noble calling. And then sometimes you don't realize that you've, kind of found your role in life. It's kind of like getting engaged. So I went down there, and then all of a sudden I realized, but I really want to marry this health center. So that I think is what gives you great satisfaction. And I just turned 75. I've gone through my own bout of prostate cancer, where my doctor, who I recruited down, saying, "Hey, you're 70, but you're still doing triathlons. Keep on getting screened. Is there any reason not to?" I said, "Okay." And so I had a very high-grade Gleason 8 prostate cancer, and 5 years later I feel great and everything looks good. So, none of us know when that doctor I recruited in helped save my life. Thank you, Dr. Poulos. But, so all of us need that access, especially people that don't have the affluence and resources that a physician would have, like myself.
Yeah. Dr. Hotz, you're such a great ambassador for our movement. I just want to thank you for joining us today, Dr. Jim Hotz with Albany Area Community Health Center.